So why might you feel tired all the time? We all feel tired intermittently, don't we? And sometimes there's an obvious cause. Maybe you've got a new baby, working really long hours, or you're just going out on too many late nights. But sometimes, if you're tired all of the time, then it might be that there's a problem. And this is such a common problem that we GPs and clinicians have a little acronym we used, TATT, which means tired all the time. In fact, around 5 to 7% of all consultations we see are based around this. So you're not alone. Certainly in this modern life, we're kind of often burning the candle at both ends and trying to do too much, squeeze too much in. So when does it become a problem? Let's find out. So what are the signs of this kind of tired all the time? You might have noticed that you've got poor concentration. You can't even watch a full movie anymore. You might find you've got general brain fog. You've got no energy in things you used to enjoy. And in fact, even the smallest of chores is just making you feel wiped out. So that's what we mean when we're talking about tired all the time. And the causes of this are huge, so very wide-ranging, which is why I sometimes get annoyed about adverts for supplements which say, tired, just have this supplement, as if that'll all make it magically fine. When often it's not that straightforward, unfortunately. So we break down the causes into 3 subheadings. So the first one will be psychological, and this is a very common cause of fatigue and tiredness. That includes things like depression, anxiety, stress, and that can be good or bad stress. So for example, even if you're planning a wedding and you're excited about it, that still can take a bit of a toll on you and you feel really tired. The second reason is physical causes, of which there are many. It may be that you've got undiagnosed celiac disease, you might have an underactive thyroid, you might have anemia, which is very common in women, especially ones who have heavy periods. You may have just a chronic health condition that can cause this tiredness, such as COPD. Sometimes we do worry because it's also a red flag symptom in some instances for something more sinister, such as cancer. Now, don't worry about that, because we only really worry about that if there's other red flag symptoms. So for example, if someone has lost lots of weight without meaning to, and they're very tired all the time, then we definitely need to look into that quite urgently. And then the third subheading is lifestyle. So we're probably all guilty of not making the right lifestyle choices all the time. And so if you're drinking too much alcohol, you're not eating a very healthy, balanced diet, you're not getting enough exercise, you're smoking, you might be taking other drugs, all that is going to impact your sleep and impact on how tired you are. We're not very good at prioritizing sleep either, and a lot of people do struggle with the sleep. So obviously if that's happening, that's going to make you feel tired. So there are some things you can do about that and some things you can't. So when should you seek medical help for this tired all the time? Well, we recommend that if you've been feeling tired continuously for at least 4 weeks, then you should go and make an appointment at your GP surgery to speak to one of the clinicians there. Then what we will do is get some information from you to find out about those things we've talked about your physical problems, your mental health, and about your lifestyle. And sometimes it's as simple as someone might say, I'm so tired all the time. And then when I ask about their sleep, they may say things like, oh no, I don't sleep well because I'm up every hour to go for a wee. So actually the problem for them is that they've got kind of a bladder problem that needs sorting out, and it's not really anything else to do with kind of tiredness itself. And once we sort that out, they will no longer be tired. So sometimes it's as simple as that. Other times it's not, there's no obvious cause, and we will typically do some blood tests to check for any sort of deficiency, any anemia, and often though that all comes back normal, and it can be quite frustrating for you as a patient when you feel exhausted and the GP saying, no, your blood tests are fine. And I always expect people to be kind of like, oh great, my blood tests are fine. And sometimes people are disappointed, and I understand that, because if you find that there's a problem, that then we can go, oh great, you just need some, for example, you need some iron tablets and then you'll feel better. So that's not always the case, and that can be frustrating. So sometimes we need to look into further investigations as well. So it might be that we're suspecting someone's got something wrong with their heart, and we might want to do some, an echo test to have a look at the heart, or we need to do a chest x-ray. It all depends on what we find in that history and in the blood tests. So there is not one simple answer. We have to be like detectives and kind of think about all possible diagnoses and therefore what investigations we need to do. But ultimately, as I mentioned, a lot of the time we don't find an ultimate cause. So what I would say in this case is focus on the number 1 and the number 3. So if we've ruled out a physical cause, then focus on psychological. How is your mental health? Could you be a bit stressed? Maybe you're anxious. What can you do about that? If you are struggling with low mood, I've got a video about depression, so have a look at that. You may find it helpful. And then just focus on things you can do to try and improve your stress levels. And have a think about the third thing, so about those lifestyle factors. There's usually things we can all do to improve our lifestyle factors, and make sleep a priority for you. So I'm going to do another video actually about sleep problems and insomnia, but kind of top tips are: keep to a routine. So try and go to bed and wake up at the same time every night. Don't panic about how many hours sleep you're getting, but you should aim to wake up feeling refreshed. So how many hours sleep that is depends on how you feel in the morning. Try not to track it, because that can actually make you feel more anxious about it. And then the simple things you can do, like not having any caffeine after lunch, trying to get lots of daytime light, because that helps you actually sleep better when it comes to nighttime. So things like that can be helpful. Obviously, if the doctor or the clinician who's seeing you is worried that it could be something like chronic fatigue syndrome, then there are specialist clinics you may be able to be referred to depending on where you live and if there's one in your area. If there is chronic fatigue, then there's certain things that can be done. Sometimes CBT can be helpful. Sometimes a personalised, graded exercise. So not the same one for everyone. Not a structured exercise program, but it has to be personalised, because you have to not push through the pain too much, because you may feel more exhausted. But if you don't have chronic fatigue syndrome, then getting some extra exercise is great. It helps you sleep and helps you feel better. Boosts those endorphins, improves your mood. So for most people, that's a really good thing to try and focus on. I hope you found that helpful. Do have a look at my other videos. I've got plenty on there on my YouTube channel that you may find helpful. Thanks for watching.